Are you struggling with fatigue, weight gain, brain fog, or hair loss, even though your thyroid labs are normal? The truth is, millions of people are living with thyroid symptoms every single day, and most of these people don't even know that these symptoms are actually because of the thyroid dysfunction. So in today's video, I'm going to reveal the thyroid symptoms you must not ignore and the tests that you should run to check your thyroid health, and more importantly, how you can fix these thyroid symptoms naturally by addressing those root causes. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician. I'm the world's Hashimoto's expert. I help people reverse their thyroid conditions by making personalized functional medicine plans. So let me first share with you 8 warning signs and symptoms that are telling you that your thyroid is not normal and you need to pay attention to them right away. The very first symptom over here is unexplained weight gain or inability to lose weight despite trying extreme diets and exercising. The reason this is happening is the thyroid is a metabolic hormone. It controls your basic metabolic rate. When your thyroid is not functioning properly, it can slow down your metabolic rate by 15 to 20%. And that's exactly the reason people do not lose weight until they fix this metabolic rate. And unfortunately, taking thyroid hormone medicine doesn't fix this weight problem. At the end of the video, I'm going to tell you the solution. But let me go ahead and share the second most common symptom. The second most common symptom is feeling tired or fatigued during the daytime. I call this pattern tired but wired. Basically, during the day, you feel very tired or exhausted. Especially in the afternoon time, you will have energy crashes and you will feel like taking a nap. A lot of times, people will be surviving on 2 to 4 cups of caffeine to go through their whole day. Lot of times in the night they will have problems with the sleeping. Why people with thyroid issues are feeling tired? It is because of adrenal dysfunction and mitochondrial dysfunction. Until you fix both of these problems, your energy is not going to come back. The third most common symptom is either hair thinning or hair loss. And doesn't matter what soap or shampoo you try, this hair thinning doesn't get better. The reason being the hair follicles have special receptors for thyroid hormone, especially the T3 hormone. And most people are not able to convert their T4, which is the inactive thyroid hormone, to the more active T3 hormone, and that's the reason their hair thinning never gets better. The next symptom is digestive issues, especially constipation, bloating, acid reflux, or IBS like symptoms. Most people are told they have IBS, but in reality it is their thyroid dysfunction which is leading to these problems. The next warning symptom over here is mood changes, especially feeling stressed out, anxious, or depressed. The reason being thyroid affects the neurotransmitter production of serotonin, dopamine, and various other neurohormones. And whenever your thyroid is not functioning optimally, the other neurohormones and neurotransmitters get affected, which leads to these symptoms. The next symptom over here is brain fog. The way people describe brain fog is that sometimes they will forget a word mid-sentence. Sometimes people are not able to concentrate on their work as good as before. And even sometimes they will feel that the memory is not as sharp as before. This is happening because your mitochondria in the brain is not working, and thyroid controls your mitochondrial health. That's the reason this brain fog happens. So all these symptoms are your body's warning lights telling you that your thyroid is struggling. The problem is this: you might go to your doctor and they might run a simple test called TSH, which most of the time comes back normal. But that is not the complete picture. To know the complete picture of your thyroid test, you need to do a complete thyroid profile, which includes these below tests. The first test is the TSH, which is the thyroid stimulating hormone. The second one is the free T4. This is the inactive thyroid hormone your thyroid gland is producing. Then you need to also check your free T3 levels, because this is the actual active thyroid hormone which reaches your body cells and asks them to do the work. Then you you need to check thyroid antibodies, specifically thyroglobulin antibodies and the thyroid peroxidase antibodies, which will tell you that your body's immune system is attacking your thyroid and leading to the destruction of the thyroid and causing Hashimoto's disease. And the last test, if you can get, is the reverse T3. This reverse T3 actually is the brakes on your thyroid gland and actually is an anti-T3 hormone. Doesn't let your T3 hormone to work on the cells. Only after you have done all of these testing, then only you can know what is happening exactly with your thyroid gland. Now the next question you might ask is that, well, I have all of these symptoms. Will the medicine fix my problems? Or I am already taking the medicine but I am not feeling any improvement. Well, the real answer is that just taking levothyroxine, which is the most common thyroid medicine, is not going to improve your symptoms. In fact, research studies show that 60% of people who are taking levothyroxine will continue to have these symptoms. Why is that so? Because there are root causes which are leading to destruction of your thyroid and causing imbalance in your body. Root causes like chronic inflammation, poor gut health, nutrient deficiencies, toxin overload, chronic stress, adrenal dysfunction, and chronic hidden infections in your body are all the root causes which is leading to this imbalance and not letting your body to heal completely. So for you to get better, you need to address all of these root causes. How do you do that? Let me share it with you over here. First of all, you need to give the right nutrients that your thyroid gland needs to function properly. These nutrients are selenium, zinc, magnesium, and vitamin D. So you need to eat a diet which is high in these nutrients. I have made a separate video which talks about in detail the best diet for thyroid issues. You can also replenish these nutrients in the form of supplements. That's the reason I have created the thyroid balance supplement, which has the right form of selenium, zinc, iodine, L-tyrosine in them. The link will be in the description if you want to buy it. So that's the first step. Once you correct the nutrient deficiency, the second step is start working on lowering inflammation in your body, because this inflammation is not only destroying your thyroid gland but is destroying your gut as well as destroying your adrenals and mitochondria. For this, you need to eat a diet which is very high in omega-3s, and you need to take specific supplements which are very high in EPA and DHA, which are forms of omega-3s that lower inflammation in the body, as well as you need to take supplements of curcumin, boswellia, quercetin. Again, I have created this special Inflammapro supplement which has all of these anti-inflammatory herbs in one capsule that is going to help lower inflammation in the body. Once the fire of inflammation settles down, this is where your body can function better. You are going to see that your energy is getting better, your brain fog is clearing up, as well as you are going to feel much better in your body. The next thing you need to do is that you need to heal your gut, because leaky gut is a major problem which is the root cause of Hashimoto's and thyroid disorders. For that, you need to eat fermented foods which are high in probiotics, as well as include prebiotic rich foods, as well as take probiotic supplements and also a supplement with high dose L-glutamine which can heal your gut. Again, I have made these specific supplements with a high dose probiotic, especially for thyroid patients, and also a gut restore powder which helps in the leaky gut patients. Then the last thing you need to do is you need to work on your adrenal glands. Stress is major killer of adrenal glands. So you need to work on a de-stressing routine of meditation or deep breathing exercises so you can rejuvenate your adrenal glands. Two specific supplements over here, one rhodiola and the other one ashwagandha, is going to help support your adrenal glands and will really help you with your energy levels. So if you're feeling tired or low in energy, make sure you're including rhodiola or ashwagandha in your supplements. Again, our thyroid balance supplement has these adaptogenic herbs, so they will give you directly without any additional supplement. Then the last thing is that if you're really tired or struggling with energy issues or brain fog issues, then you need to take specific supplements to support your mitochondria. The two supplements which help really good over here, one of them is coenzyme Q10 and the other one is acetyl L-carnitine. Once you add both of these supplements to the above program, you see amazing results in improving your energy and also improving your brain fog very quickly. So, if you're dealing with fatigue, weight gain, brain fog, hair loss, don't accept them as normal aging or normal symptoms that every woman goes through. These could be your thyroid signs and symptoms, and you should not ignore them. The first step, get the complete thyroid testing, and the second step, start working on your thyroid gland in a more natural and a holistic fashion, and you will see these symptoms and signs improving for you. I hope you like this video and have a better understanding of your thyroid and now have actionable steps to get control over it. Please like and subscribe to my channel so you keep on getting this great information in the future also. Until next time, take care. Bye bye.